Great. Well, great to see everybody here, and thank you, John, for that very nice introduction. Also, as some of you know, John was very nice to host a number of us at his lovely home last night in sort of a pre-conference reception. I got to meet John's wonderful family, including his mom, Madge. And I know you're going to get a lot of insights and ideas at this conference, but here's one I'll throw out right at the beginning. For when you run into a colleague's parents at an event like that, I found it's helpful to say something like, your son or daughter has accomplished so much in their career, and even more importantly, they're admired by everyone who knows them. And in the case of John, that's actually true. So thanks for the opportunity to be here and speak to you for a little bit this morning, and as John mentioned, to share with you the excitement that we have at Change Healthcare about blockchain and how we think it can truly transform healthcare. But before I do, I'd like to set the stage for why we think this is the right time for blockchain in healthcare. So let me start with some of the factors that are driving the opportunity for blockchain in healthcare. Some of you in this audience have a great deal of experience in healthcare. Others are more what maybe I might call pure technologists. You know, at our company, Change Healthcare, we're very fortunate to have people that have a passion derived typically from one or both of those areas. Some of my colleagues were formerly the CEO of GE Healthcare in the Americas, the person who created the Optum brand, which I'm sure many of you have heard about in healthcare, a person who did enterprise software development and led that at Adobe, the former CFO of TransUnion, the former CEO of JP Morgan's data commercialization business, the person who created the leading cloud-based artificial intelligence platform for healthcare. So I think, I would bet when the organizers here look at the people attending this conference, you're going to find a myriad of people very interested in the transformative capabilities of blockchain in healthcare. And we really welcome the input, the ideas, and the experience of people from a variety of backgrounds, given the challenges and opportunities we have in the healthcare system. But this chart up here in talking about the explosion of data is a little bit more for the technologists in the audience. Given the amount of data that's being created in healthcare, it's what we might call a target-rich environment. The amount of healthcare services is going to continue to increase. Virtually every expert in the country has confirmed that the units of healthcare services, if you will, irrespective of payment reform and what's going on in Washington right now. And it's going to happen for really two fundamental reasons. One is the aging of the U.S. population. And as I'm sure as many of you know, people of retirement age typically use as much as 4 times as many healthcare services as people of working age. And then in addition, there's a prevalence of chronic disease in this country, which drives the vast majority of healthcare costs, including the increases in healthcare costs, and which we unfortunately don't seem to be doing a great deal in order to really reduce the slope of that increasing incidence, prevalence, and cost curve. So like it or not, those of us that are in healthcare are in a growth business over the intermediate and long term. However, that's not primarily the reason that we believe data is exploding in healthcare. Let me tell you what I think are the two reasons that are really driving what you see on this chart. First of all, as many of you know, Change Healthcare and its predecessor companies, MDON and others, have been among the leaders in digitizing financial and administrative data in healthcare for 3 or 4 decades. However, the big new news over the past decade is the digitization of clinical data, which truly allows us to migrate analytics and services into really contributing to what we and others call value-based healthcare. We believe that ultimately we're going to move beyond the continuity of care document and the fast healthcare interoperability resources API or FHIR into architectures that truly access and utilize what we call atomic level data. Data that allows us to access the granularity and timeliness of data for real-time analytics and artificial intelligence that we are just beginning to explore. So that's reason number one. Reason number two is that healthcare data, as it's typically termed, is really being augmented by what I would call health data. This is really leading towards an explosion of the amount and the diversity and the complexity of data that's relevant to your health. Unless you're undergoing an immediate acute care episode right now in your life or that of a loved one or family member, less than 10% of the relevant data to help you maintain or improve your health is contained in what we typically call the healthcare system, as shown by the chart on this slide. In addition to the work that we do here in Nashville, as you've just heard, which is growing exponentially, not only in its classic healthcare orientation, but really around healthcare IT, we expect Nashville to continue to grow and not only be the healthcare capital of the United States, but the healthcare IT capital of the United States, alongside cities like Silicon Valley, Seattle, and Boston. In addition to the work that we do here at Change Healthcare with the Nashville Healthcare Council, I'm privileged to sit on the board of Nashville Health, an organization founded by the former Senate Majority Leader, Dr. Bill Frist, to address the challenges as shown on this chart that we have right here in Middle Tennessee. Despite the growth in this area of the country and the concentration of healthcare resources and professionals, clinicians, administrators, IT professionals, Tennessee is still only the 38th most healthy state in the union, up from 41 next year, but still, we have a long way to go. As shown on this graph, in order to grapple with improving the healthcare status and the population health of cities, counties, states, and the whole country, we need to not only address the data that's typically found in what we call the healthcare system, but social and environmental factors and individual behavior, typically called the social determinants of health, that together account for 60% of the reasons why someone is healthy or improving their health. Genetics, of course, is another area. It's an explosion of research and capabilities being generated there. But I think this is important for all of us to understand, and it's been important for us to understand at Change Healthcare as we've invested in companies and purchased companies that really have given us tremendous insights to the type of data that exists, frankly, outside what we typically call the healthcare system. However, even with that, healthcare industry and regulatory experience remains very important. We're collaborating with people including ONC, and I was in Washington last week meeting with Dr. Don Rooker, who probably many of you know is the National Coordinator for Health Information Technology at HHS, and he fully acknowledges this need to think more broadly about healthcare data and applying technologies such as blockchain to really leverage that data to help people improve their health. At Change Healthcare, acknowledging the importance of the breadth of data that we need to apply to these opportunities, we're collaborating with all three of the major cloud providers and data companies in the global technology landscape around this opportunity. So with that, let me tell you a little bit more about our company, Change Healthcare. Change Healthcare is an independent healthcare IT and services company. We have about $3.5 billion in revenue, 15,000 team members across the United States, about 4,000 contractors. We're fortunate to work across the entire ecosystem in healthcare, which, as I've mentioned, I think is going to be very important for the future. And working with people like Hashed Health and other people at this conference, we're fortunate to be working at some of the leading edge technologies that we believe are going to make a difference in really improving healthcare in this country. As many of you know, we have the largest healthcare network in the country. There's some factoids here on this chart on the right. We're fortunate to work with virtually all the major health plans, the majority of the hospitals and integrated delivery networks in this country, over 800,000 physicians, 1 in 5 U.S. patient records, and in the $3 trillion U.S. healthcare system, we process about $2 trillion in healthcare claims and 12 billion transactions per year. So when we look at technology such as blockchain and others, we're thinking about how these are going to operate at scale, which to do what we need to do in this country around communities, population health, and advancing the use of data, it's going to be critical to be able to address those issues. Speaking of some of the issues in healthcare more generally, I think we need to acknowledge that there are some real problems that we see our customers and vendor partners dealing with. Despite the $32 billion plus spent on electronic health records in this country, we still have too much data that's siloed and a lack of interoperability. We've tried to step up to this by supporting the Commonwealth Health Alliance that uses our intelligent health network, and we're now building a bridge between that consortium of industry players and the Sequoia Project and Care Equality so that any person or physician or caregiver using the electronic medical record products that are part of either of those two consortiums, which is essentially every electronic medical record in the country, will be able to share data, particularly CCDs and other well-accepted architectures. So we've tried to do our part in this, but as I was discussing with Dr. Rucker last week, we still have a lot of issues around data blocking and other elements that certainly HHS and CMS is worried about, and we need to make sure that we're addressing as an industry. Given some of the things that have happened over the past couple weeks, I'm sure I don't need to mention the risk of cyber attacks and breaches. Certainly some of the institutions here, as well as across the country in healthcare, have been victims of that. It's something that blockchain, we believe, has an important role in helping prevent. For some of you that may not be aware, if you go on the doc market to actually buy illegal data, healthcare data is actually worth more now than credit card data. And that may seem surprising given the ability to earn money with false credit card and other personal data, but it really comes down to the complexity of the U.S. healthcare system and the ability of bad actors to initiate fraudulent mechanisms in order to get gains using healthcare data. So we have an important responsibility to protect every single one of all of your data, as well as people throughout the system. The other point in here is this lag in data accessibility. As John mentioned, I've been fortunate to spend a lot of my career in some fairly decent healthcare or just IT companies. And one of the things that still is remarkable to me in healthcare is that we don't talk about data being available typically in milliseconds, but sometimes people use minutes, and sometimes they use multiple minutes, and sometimes they use multiple days. You know, it really still is amazing to me that when we work with a lot of our customers, we're still trying to move away from batch processing. So we have to invest in this, but we have to do it in conjunction with the rest of the ecosystem. And it's something that we believe over the next decade will really be putting in more of a real-time system across healthcare. And then finally, we have to admit in this country that we just spend too much on administrative and financial capabilities, lags, issues around data normalization and cleaning data. If you talk to most of the experts around healthcare economics, they'll tell you that in this $3 trillion system, approximately 12% of that expense is spent on financial and administrative overhead. 12%. That's $360 billion. If you look at research done by McKinsey and others, they'd say that at least $100 billion of that is not needed, even for the system to operate the way it operates today. Imagine what we could do in this country if we put another $100 billion into keeping people healthy and helping them improve their health. And that's what gets us excited at Change Healthcare every day, to try to capture that value and put it back into the healthcare system. So let me talk a little bit about blockchain and why we're such big proponents of using blockchain in healthcare. So first of all, on here you'll see there's a number of attributes of blockchain that if you weren't at the conference last year, you'll certainly learn a great deal about at the conference here today. Just to mention a couple of these, I talked about the siloed data. One of the things obviously the blockchain can bring is allowing payers, providers, and other people providing value-added services to operate directly on the same data. One of the biggest issues and one of the biggest expenses we have in healthcare is actually even creating high-quality data. Data normalization, data cleansing, the use of frameworks that allow people to have confidence on the analytics they're doing on top of data. Using blockchain, we can provide a much more cost-effective way of sharing, leveraging, and allowing people to depend on the same data. In the case of blockchain, the network is incented to prevent bad data to be stored on the chain or remaining in the chain. In terms of the importance of longitudinal data, given that people are living longer, and while it's not always quite so relevant what healthcare issues you might have had in high school when you're 60 years old, a lot of people, especially the number of people with chronic disease, that longitudinal care data is very important. The durability, the reliability, and the longevity that are core to blockchain's capabilities and the immutability of the data on the chain will allow us to continue to leverage that longevity of data. Another example is around the transparency of data. If we can start using blockchain more, all participants will understand the entire transaction history of the encounter and improve the ability to do bundling and other payment reforms and innovations that are discussed quite a bit in Washington. I mentioned the data lag and the lack of real-time capabilities that permeates healthcare today. Of course, if we can get blockchain technologies more distributed and inserted into the flow, we will have to spend less time waiting for sending data, batch writes, and other data movement, something that we have long sought to do and look forward to blockchain and facilitating that. And then finally, as I mentioned, we spend too much money, frankly, on all the manipulation of data and the financial and administrative aspects of healthcare. And we believe that using blockchain, we can lower transaction costs. Now, I've mentioned a few things that we think are important around blockchain, but of course, the great thing about both this conference and the innovation that's represented by many of the people here and many of the people, as John mentioned, doing startups in blockchain and other areas, is that there's things we haven't even thought about yet, where this technology will help facilitate innovation, new services, and hopefully healthier Americans. Imagine what we can do across broader continuums of care than just the inpatient or even outpatient continuum when we have higher quality data immediately accessible to caregivers and other service providers outside the electronic medical record. As I mentioned, population health, something today that is often done with a lot of very cumbersome, work-intensive, and data lag type processes, will be facilitated if we can remove the need for the aggregation and the population statistics and data normalization that's necessary today. We believe we'll have faster financial and administrative efficiency as people are able to access data and provide new and improved analytics in order to optimize not only the healthcare payers and providers' use of healthcare data, but equally important, consumers' use of healthcare data, so people can truly become better shoppers and more informed healthcare consumers. And then finally, data liquidity. There's a major effort here in Nashville, probably many of you are aware of, the Center for Medical Interoperability. And we're big supporters of what Ed Cantwell and the members of his board are doing to really provide more data liquidity also inside the hospital, not only between the EMRs. So there's a ton of potential here. There's a number of examples on this chart, and we certainly hope that many of you and friends and others you know will create startups or work with companies like us to take advantage of the capability of blockchain in the years ahead. So what are we doing at Change Healthcare? As I mentioned, we have this intelligent healthcare network where we're fortunate to be able to collaborate with payers and providers and other vendor partners throughout the industry. What we've decided to do after a couple years of work and what we're announcing today is that we're introducing blockchain as a core capability of our intelligent healthcare background. We're going to leverage the capabilities that are being created both within our company as well as through our collaboration with Hyperledger. And I would like to acknowledge the leadership of Brian Bellendorf, the executive director of Hyperledger. I don't know where Brian is, over there in front. We have really benefited from the leadership he and his team have shown in conjunction with the Linux Foundation and really beginning to grow Hyperledger to as important an organization as we believe is out there regarding the blockchain. As the only healthcare premier member of Hyperledger, we are going to be a major contributor of IP to the global blockchain community alongside our peers who are other premier members of Hyperledger, such as Accenture, Cisco, IBM, JP Morgan, SAP, and others. In doing so, we believe we can connect our intelligent healthcare network directly to our customers as they begin to develop more and more of an appreciation and an interest and an acceptance of utilizing blockchain in their institutions as well. With our approach, we will be able to use blockchain in our network. There will not be an API between our blockchain and our customers, because we're going to create a true blockchain-capable, intelligent healthcare network platform, building from the inside out in order to not get too far ahead, frankly, of our payer and provider and other vendor partner customers who, as John mentioned earlier, are really at an early stage in understanding how to leverage blockchain in their own systems. As shown on this chart, we're going to use the Hyperledger Fabric 1.0 framework. Let me tell you a couple of reasons, and certainly if you want more detail on this, our Chief Technology Officer, who sits on the board of Hyperledger, is here, Aaron Szymanski. Where's Aaron? Over here near Brian. So feel free to catch him over the next 2 days to get more details. But we chose the Hyperledger Fabric for a few reasons. One, it's open source with a very strong and active open source community that we contribute to and look forward to continuing to contribute to. It's got a modular and extensible architecture that provides the industry, we believe, with the greatest level of flexibility. Many of the blockchain technologies, I'm sure many of you know, were originally designed for the financial market. We think one of the great things of Hyperledger, and as really exemplified by its membership, it's been designed to be flexible and adaptable to virtually any market. I mentioned the importance of privacy and security, and the fine-grained access control there, we believe, is critical as well. For example, Hyperledger provides channels that allow the partitioning of message flows such that clients only see messages and transactions of the channels that they're connected to. And therefore, we have the ability to restrict access to transactions and therefore protect the data of our customers and their patients and members and to provide appropriate security. We believe that the model provides greater performance and scalability through the context model. Only parties taking part in the transaction have to reach consensus versus everyone, and the consensus only has to be reached at the transaction level, not at the ledger level. We've used some of the technologies and capabilities that Hyperledger's designed for our consensus model. We picked the consensus coordination and agreement model. We chose Apache Kafka. That's offered as part of the Hyperledger Fabric solution. We believe it's got the appropriate performance, scalability, as well as I mentioned, the ability to separate transactions across discrete channels that allows us to deploy this technology in the scale of a network that processes over 12 billion transactions per year, yet still needs to provide the security and the integrity of the data that's important to our customers and their customers. Just to tell you where we see this going, because I think, again, as John and others have mentioned and will mention in this conference, we're still at a relatively early stage in introducing blockchain pervasively across the healthcare system. So we're initially established this blockchain as a private blockchain because that's what our customers are ready for, but have developed a roadmap to migrate this, as shown on this chart, to a permissioned and then public blockchain where and when possible. By placing a private blockchain in our intelligent healthcare platform, we can do the experimentation and implementation around a large-scale, high-volume network as a foundation for blockchain-based interactions. We will leverage these capabilities directly and work with our customers to continue to move across the right side of this chart as the industry continues to mature in its understanding and use of blockchain. As we integrate through our customers, we will move towards a permission chain where the customer and change are sharing the same blockchain and interacting through that chain. This is the central part of this diagram, which shows the growth of service and products built upon these protected blockchains between Change Healthcare's intelligent healthcare network and our customers. While we're developing these products and services in collaboration with our customers and vendor partners, and hopefully many of you in this room, this will also create an open space where questions around competitors having visibility into transactions and how to effectively create a public blockchain in healthcare can be explored, piloted, and ultimately answered. So at the right we're showing the ultimate future state, where the business models will be established, PHI, or protected health information, and identity approaches will have been proven, and a public blockchain can truly be considered for healthcare. So this is a journey, and what we're trying to do is enable the first step, try to help our customers, vendor partners, and the industry move forward. However, as I'm sure you'll hear in this conference, and to be realistic, there are some headwinds that are going to be needed to be overcome in order to help blockchain become truly pervasive in the industry. And I've listed a number of them on this slide. We encourage all of you to engage with us and the rest of the community to overcome these. A couple of things I'd ask people to particularly focus on is engaging more and more participants in the network. This problem that people will talk about there being too few nodes. There shouldn't be free riders. People need to get into the boat, if you will, start rowing or sailing, experimenting with blockchain, improving what works, and what issues we then need to address. There continues to be a number of pros and cons about information that's on the chain or off the chain. Again, only by experimenting and putting projects in place with important, scalable collaborators will we address these issues. And perhaps one of the things that in here that maybe seems a little perhaps odd for anybody that's new to the healthcare industry per se is this mindset about an unwillingness to share data, understanding that it's only truly, as I mentioned earlier, of integrating data from really your life, not just your interactions with the healthcare system, that this can really be successful to help people improve their health. We believe that the use of data creates value. The storage and siloing of data is just a cost. So I'd ask you to bring that forward when you work with your partners, customers, and innovators in healthcare. And then finally, we believe the blockchain evolution or revolution in healthcare needs to serve everyone. We've spent a lot of time trying to get government officials for both the state level and at the federal level comfortable with blockchain. As I mentioned, I was meeting with Dr. Rucker last week. I testified on data liquidity before Congress last year with others from the industry. So for some of you, this may not be your top priority, but for others that have the opportunity to influence your public officials or influence regulators, I'd ask that you not forget that, because ignorance is not our friend in increasing the acceptance of blockchain across the industry. So finally, how do we at Change Healthcare see the future of blockchain, both here in the United States and in our operations outside the United States? We believe that blockchain will succeed if we focus on the value that it can provide to a network of participants, not just the value that it can provide to our individual companies or customers. That's one of the reasons why we believe so strongly in a collaborative model based on open source technologies in order to promote the use of blockchain in healthcare. We're ready to work with every company in this room and across the industry and outside the healthcare industry, as I've mentioned, in order to take the next steps in promoting the use of blockchain in healthcare. I hope you leave this conference believing that blockchain in healthcare is not a hypothetical anymore. It's not something to hope for, and that you know that we, with our partners, are backing blockchain and implementing it in the largest intelligent healthcare network in the country. We believe greatly in collaboration, and not only with Hyperledger. If you'd like to work with us in this area, we certainly would welcome any conversations, and we have the email up there, blockchain@changehealthcare.com. I hope you have a great conference. I hope you leave here energized and a proselytizer for blockchain in healthcare, and we hope to work with you on the journey to a better U.S. healthcare system. Thank you.